Hey guys, my name's Mara. I'm a personal trainer and physical therapist assistant here at the ranch. Today I'm going to go over 5 different exercises that can help with low back pain. As many as 80% of the population will suffer from back pain at his or her life, so it's obviously very prevalent. So that's why I wanted to just give you guys some things to work on at home. So back pain can, there's a wide array of things that can cause it. It can be many factors or it can be something more specific. So a thorough PT evaluation can give you more specific diagnosis, and from there we can give you more effective treatment. So take these exercises with a grain of salt. No, they won't necessarily help everyone, but they are in general good things to start with. All right, so the 5 we're choosing are going to work on both mobility and stability of the lumbar spine. So the first one we're going to do is called Windshield Wipers. So you're going to come down on the ground here. You want to bend your knees, just relax the upper body, and then let your knees fall from one side over to the other. So just a gentle motion back and forth, nice easy pace. Good. So just bringing rotation through the spine, blood flow to the area, trying to loosen up the low back. So I often recommend people do these in the morning or anytime throughout the day when they're feeling extra stiff. And I would do at least 10 reps each side. That's just kind of a general guideline. You can do more, of course. And I would do it at least 2 or 3 times a day. All right, so that's number 1. Second one, switching gears. So coming on your stomach, legs will extend behind you. And then just kind of settle in on the floor. It's called a press up. So start slow, come on up just to your elbows and back down slowly. If that's feeling pretty comfortable, you can work on going further up to the palms. But again, stick within kind of your comfort zone. You never want to push too far into pain. So if you've only got that for range of motion, that's totally fine. Just feel out your body. Again, take a nice slow pace. And you want to hit at least 10 of these as well. All right. Third one for mobility is called a child's pose. So if you've ever done yoga, very familiar with this exercise, I'm sure. But you're gonna start on your knees, and then you wanna just kind of sink back towards your heels while stretching forward with the arms. So just breathe into that stretch. You wanna relax your neck, but I wanna make sure you hear me, so. Oh, hi, Ari, are you gonna stretch too? Yeah? Good. So breathe into that. As you loosen up, you might be able to reach further. And then I recommend holding at least 30 seconds. Research shows that that's pretty optimal for stretching and to get benefit for muscle lengthening. You can hold longer, but research doesn't really support that holding longer stretches really provides any extra benefit. So 30 seconds, good rule of thumb. Again, do several times a day. All right, last 2 are for more the stability aspect. First one is called a dead bug. So back on your back here. There's ways to modify this, but I'm gonna show you just kind of as prescribed. So you wanna think about flattening your back almost towards the mat. So you can see I stuck my hand here, and then I wanna just kind of press into that hand. Remove your hands then while holding and engaging that spine. Okay, and then as you go through the movement, you want to make sure that your spine's not really changing. So you really want to fight against the weight of your limbs to hold that position in your spine. So from there, hands and knees are pointed towards the ceiling. You're going to lower left leg, right arm. Hopefully you can see me. Sorry, guys. And then just alternating opposite arm, opposite leg, while trying to maintain that spinal position. If you're finding you can't hold that, You might want to just do like a tap with the leg instead. So keep it bent versus lengthening. Okay, good. So that's just going to provide a little extra support around the spine, and then hopefully transfer into daily life so that your back's not working quite so hard, and will hopefully give you some pain relief. And then your fifth exercise is just a bridge. So thinking about what I just said about engaging the core and not letting your spine position change throughout the exercise, you want to re-engage that core again. Knees are bent like so. And then as you're holding your tummy tight, you're going to squeeze the glutes and lift the hips straight up. So again, try not to let that spinal position change throughout the movement. You can relax at the bottom if you have to reset, and then just tighten up and go again. Nice, easy pace. Again, want to do at least 10 of those. As they get really easy, you can do more, and then just work on doing those every day. All right, so again, those were just some general exercises. If you actually come to physical therapy, we can get you a more specific diagnosis, and then from there, we can do more hands-on work and then give you exercises that are more specific to your condition and your general fitness ability. So if you have any questions, feel free to reach out to us here at the ranch, and we'll get those answered for you. Thanks, guys.